He was a trusted doctor treating patients in hospitals across the world. But behind the scenes, people around him kept dying quietly and mysteriously. This is the story of Michael Swango. Michael Swango was born in Quincy, Illinois, in 1954. From the beginning, he appeared to be the kind of child any parent would be proud of: bright, well-behaved, and gifted in multiple areas. He excelled academically, played the clarinet, and later served in the Marine Corps. To most who knew him, he was disciplined, polite, and ambitious, the type of person you'd trust without a second thought. But there was another side to Swango, one that few saw and even fewer understood. As a teenager, he developed a strange obsession with death, not in a philosophical sense, but in a deeply disturbing one. He began collecting newspaper clippings of fatal car accidents, meticulously filling scrapbooks with photos and articles about mangled wreckage and sudden, violent deaths. He didn't just read them, he studied them. This fascination with death wasn't a phase. It was a fixation that stayed with him and quietly followed him into adulthood. When Swango entered Southern Illinois University School of Medicine, he seemed to be on track for a respectable career. He was intelligent, driven, and outwardly professional. But early into his medical training, red flags began to surface. Patients under his care started dying unexpectedly. Sometimes they would crash shortly after he visited their rooms. Other students began to notice the pattern. A few grew suspicious. Some even tried to avoid working with him. But nothing concrete could be proven, and in a competitive, high-pressure environment, intuition alone wasn't enough to raise alarm. What's even more disturbing is how Michael Swango managed to pull all this off while living what seemed like a normal life. A devoted doctor and a model employee. And if you're fascinated by how these killers hid in plain sight, don't miss our playlist on serial killers who lived a double life. From respected doctors to trusted church leaders, you'll be shocked at how far some went to maintain the mask. You can check it out after this video. The church leader who hid his crimes in plain sight. Link is in the description box. From the outside, he looked like the perfect doctor. But behind that smile, something was very wrong. After graduating from medical school, Michael Swango began his internship at Ohio State University Medical Center. It wasn't long before patients once again began dying under strange circumstances. Elderly patients who had been stable suddenly went into respiratory distress. Code blues became routine, always seeming to happen when Swango was nearby. Staff began to notice. Some nurses quietly compared notes, realizing a disturbing pattern. Whenever Swango was on shift, the rate of medical emergencies spiked. One nurse later reported that patients would often decline immediately after receiving injections or medication from Swango. Another recalled walking into a room seconds after he left, only to find the patient unresponsive. And yet, despite the whispers, despite the suspicion, hospital administrators didn't act decisively. An internal review was launched, but it quickly fell apart. The case was quietly closed. There wasn't enough evidence. No one wanted the negative attention. No one wanted to believe that a doctor could be intentionally harming patients. Swango was asked to leave, but not reported, not flagged, not stopped. From there, he found another hospital, then another. Each time, he used glowing recommendations and carefully forged documents to move on. And each time more patients died. At one hospital in Illinois, coworkers noticed he carried his own syringes and refused to let anyone else handle them. At another, a nurse walked in on him injecting something into a patient's without explanation. When questioned, he dismissed it. The incident wasn't followed up. In some cases, concerned staff went to hospital leadership with their fears. But instead of taking action, administrators chose to avoid legal risk and bad publicity. Their silence allowed Swango to keep practicing. The same story played out again and again. Swango would be quietly let go, only to show up somewhere else with a clean record and a new set of victims. The medical system, designed to protect patients, became his cover. He slipped through every crack, helped along by institutions unwilling to confront the truth. Everywhere he went, death followed, and no one stopped him. By the early 1990s, Michael Swango's reputation in the U.S. was catching up with him. Whispers had turned into reports. Investigations were surfacing. But instead of being held accountable, Swango simply disappeared. This time, beyond American borders. He set his sights on Africa. Using forged documents and fake references, Swango secured a position at Nene Mission Hospital in Zimbabwe. To the staff there, he seemed like a gift, a well-trained American doctor willing to serve in a rural community. But soon after his arrival, the same chilling pattern emerged. Patients began dying unexpectedly. In one case, a young woman admitted for a minor condition suddenly went into convulsions after receiving an injection from Swango. She died within hours. Another patient, previously stable, passed away mysteriously following his treatment. Nurses grew alarmed. Their patients weren't just dying, they were dying in ways that defied medical explanation. This time, suspicions grew louder. Some staff began keeping quiet records, noting exactly when Swango was on duty and which patients he treated. The data revealed a terrifying correlation. A formal investigation was launched, and Swango was eventually asked to leave Nene. But again, no criminal charges. No official reports to international medical boards. He slipped away once more. From Zimbabwe, he moved to Mpilo Central Hospital in Bulawayo. And again, more unexplained deaths. Again, concerns raised. And again, he vanished just before authorities could close in. Swango didn't stop there. He applied for work in South Africa and then managed to enter Saudi Arabia, where he briefly worked at a hospital in Riyadh. In each case, he used his credentials from U.S. institutions, carefully edited resumes, and the illusion of legitimacy to gain entry. The institutions hiring him never knew or never bothered to check his past. And wherever he went, death quietly followed. By now, he had become a ghost in the medical system, moving across borders, across continents, always one step ahead of suspicion. His charm, credentials, and clean paperwork masked the truth that he was likely responsible for dozens, if not hundreds, of deaths. Michael Swango wasn't just a killer hiding in a hospital. He was one of the most prolific medical murderers in history. And no matter how many warnings were raised, the world kept letting him in. Back in the United States, Michael Swango's crimes were escalating, not just in hospitals, but among his own colleagues. At one point, while working as a paramedic and later at a hospital in Illinois, co-workers began falling mysteriously ill. Perfectly healthy nurses and staff started experiencing sudden nausea, dizziness, and vomiting during their shifts. Some had to be hospitalized. At first, no one could explain the symptoms, but a pattern emerged. Every one of them had either eaten food or drank coffee brought in by Swango. When investigators finally stepped in, toxicology reports confirmed the presence of arsenic in several victims. It was deliberate, controlled, clinical. Swango had been poisoning the very people he worked with, just to watch them suffer. In 1985, he was finally arrested and convicted, not for murder, but for aggravated battery related to the poisonings of his co-workers. He was sentenced to 5 years in prison. But that wasn't the end. Swango was released early for good behavior. And then he vanished again. This time, he used a new identity, altering his name and forging more documents to rebuild his image. He applied for residency programs, this time as Michael Swan, and continued presenting himself as a clean, qualified physician. He re-entered the medical field, again, and people continued to die. Even with a criminal record, even after a confirmed poisoning conviction, Swango managed to keep getting hired. He leveraged legal loopholes, administrative oversights, and a system that was more concerned with paperwork than with people. He had poisoned coworkers, killed patients, served time, kept a journal of his crimes, and still he was free to keep going. By the mid-1990s, the trail of suspicious deaths following Michael Swango could no longer be ignored. Federal authorities, along with determined journalists and medical professionals, began piecing together the puzzle. What started as a handful of isolated cases had grown into a disturbing pattern that stretched across states and continents. Investigators started digging into Swango's background, and what they found was a web of lies. His resumes were fake, full of fabricated positions and falsified recommendations. References couldn't be verified. Licenses were forged or obtained under false pretenses. One application after another, built on deception. As suspicions grew, authorities began looking back at former patients, particularly those who had died suddenly, with no clear cause. Autopsies had never been performed in many of those cases, but now that was about to change. Exhumation orders were filed, graves were opened, and when they tested the bodies, what they found confirmed their worst fears: traces of lethal substances, cyanide, arsenic, muscle relaxants used in lethal doses. The deaths had not been natural. They had been planned, executed with precision, and they pointed back to one man, Swango. The investigation gained momentum. The FBI, along with Interpol and various health agencies, began coordinating across borders. Testimonies from former colleagues, nurses, and even patients' families painted a horrifying picture. A man who moved in silence, smiling in hospital hallways by day, while quietly ending lives behind closed doors. Medical records were reanalyzed. Hiring trails were retraced. The pattern was unmistakable. Swango hadn't just slipped through the system. He had exploited it at every turn. Every gap in regulation, every lapse in oversight had become an open door. But now, the door was closing. The net was tightening. And for the first time, Swango was out of places to hide. In 1997, after years of evading accountability, Michael Swango's time was finally running out. The FBI had gathered enough evidence to pursue him globally. With help from international law enforcement, they tracked him to O'Hare International Airport, just as he was trying to flee the country once again, this time en route to Saudi Arabia for yet another medical job. He was arrested before boarding the flight. What followed was a series of criminal charges, led by the U.S. federal government. Swango was initially charged with fraud for falsifying documents, but prosecutors were building something much bigger. They wanted him for murder. As the case grew, investigators linked Swango to deaths in Illinois, Ohio, New York, Zimbabwe, and possibly Saudi Arabia. In custody, the pressure mounted. Faced with overwhelming evidence, including his own journal entries, forged credentials, witness testimonies, and toxicology reports, Swango finally struck a deal. In 2000, he pleaded guilty to killing 3 patients in New York. But the truth went far beyond those 3. During sentencing, prosecutors revealed their broader findings. Swango was suspected of killing over 60 people, possibly more. His victims were patients, co-workers, and even strangers. He had crossed borders, manipulated systems, and used the cover of medicine to carry out a global killing spree. Michael Swango was sentenced to life in prison without the possibility of parole. He is currently serving his sentence at the ADX Florence Supermax prison in Colorado. His case sent shockwaves through the medical world, exposing just how vulnerable even the most trusted systems can be when no one is willing to ask the hard questions. To this day, the exact number of his victims remains unknown. But one thing is certain: Michael Swango didn't just betray his oath as a doctor. He redefined what it means to live a double life.